Diagnosing body lice and scabies. What's the difference?
Hello and welcome to our discussion on two common yet often confusing skin conditions, body lice and scabies. In this video, we will talk about how to diagnose these two conditions and if there are specific tests that can help distinguish one from the other.
What are body lice?
Body lice are tiny insects that live on the human body and clothing, causing an extremely itchy skin condition. They are spread through close personal contact or sharing clothing or bedding with an infected person. To diagnose body lice, doctors primarily look for signs and symptoms, such as intense itching and rashes. They may also check for the presence of lice or their eggs, nits, on the body or clothing. Body lice are visible to the naked eye, though a magnifying glass might be needed to spot the eggs.
How is scabies diagnosed?
Scabies, on the other hand, is an infestation of the skin by the human itch mite. These mites burrow into the upper layer of the skin where they live and lay eggs, leading to severe itching and rash. Scabies is diagnosed by identifying signs such as intense itching, especially at night, and a pimple-like rash. The doctor may also look for burrows in the skin where the mites have dug in. To confirm the diagnosis, a skin scraping might be done. The sample obtained is examined under a microscope to identify mites, eggs, or mite fecal matter.
How to differentiate between body lice and scabies?
While both conditions cause itching and rash, they can be distinguished based on the location of the itching, the appearance of the skin, and the findings of clinical examinations. Body lice often cause itching all over the body, especially along the seams of clothing where they tend to lay their eggs. On the other hand, scabies commonly affects areas such as between the fingers, the wrists, and the waist. Skin signs are also different. Body lice infestations usually lead to small red bumps, while scabies may present with more distinct burrow tracks in addition to a pimple-like rash. Also, the diagnostic tests for each are different. While body lice and their nits can be seen on the body or clothing, the diagnosis of scabies usually involves a skin scraping test to find mites or their eggs under the microscope. In conclusion, while both body lice and scabies present with similar symptoms of itching and rash, they can be distinguished through careful clinical examination and specific tests. Remember, if you suspect you or a loved one might be dealing with either of these conditions, it's important to seek medical advice promptly. We hope you found this video helpful and gained a better understanding of these common skin conditions.